The steering group with the primary care team were really interested in seeing whether we could reach out to GPs to help assist with promoting Join Dementia Research. And historically, we found it quite difficult to actually register people from a GP practice. During the COVID-19 pandemic, we recognised as a team that we needed to look at alternative ways in which we could actually reach out to the public to let them know about Join Dementia Research. Within the East Staffordshire region, you have a group of GP surgeries who are very, very research active. And one of the things they are very good at using as well is text messaging service, just to promote ideas to their patients or to inform them of stuff. So we thought, well, is there an opportunity there for us to reach out to these GP practices to see whether we could promote Join Dementia Research via the text messaging service? Initially, we approached 5 practices to see whether they would be involved, and they did say they would be quite happy to do so. They had a catchment area between the 5 of them of about 25,000 people, and the proviso was that as long as anybody was over the age of 18 and they were actually happy to receive a text message from the GP service, those were the ones that were chosen and the message was sent out to them. We were really quite pleased with the initial results from this because we had 51 people actually sign up to Join Dementia Research. And we found that this was actually really quite an easy way to do it. It didn't take that much time. And for a comparison, we did attend the dementia walks that go on a couple of times a year with the Alzheimer's Society. And at one of the walks that we actually attended, we had 15 people volunteer. So we thought we did really well. I think more than anything else, we really like to thank the GP practices for getting involved, because we know they have so much to deal with, especially over the COVID-19 period. And it's just a big thank you. Thank you for supporting us. The lessons that we actually learned from this was we think timing is essential. So let's look at Dementia Action Week or maybe Alzheimer's Month, because it's in the public psyche and it's being promoted widely. Getting your practice managers on board, I think, is key to it, as I think everybody would agree. Maybe even looking at the initiative itself. Can it be tweaked? Which is something that we did. We just looked at it and thought, well, rather than going for lots of practices, let's maybe keep it a little bit smaller to manage. And then I would also say that text messaging is really quite inexpensive. So it didn't really cost much at all to do.